Hi everyone, this is Dr. Janvi. In this video, I'll explain about thyroid disorders. Why? Because 50% of people in the world are suffering from thyroid disorders, and among them, one third people do not even know that they are suffering from a treatable disorder, and people who know neglect the disorder. And this particular disorder treatment, lifelong commitment is necessary. Firstly, I'll explain about what is thyroid, what are thyroid disorders, and their causes, their symptoms, and their treatment. Thyroid. It is a gland in front of your neck that is a part of the endocrine system. Thyroid hormones help you metabolize fats, proteins, and carbohydrates. They help to maintain your blood pressure, body temperature, and heart rate. Thyroid disorders and their types. Thyroid disorder occurs when thyroid is not making the right amount of hormones. There are two types, hypothyroidism and hyperthyroidism. Hypothyroidism is usually defined as deficient production of thyroid hormone. Hyperthyroidism is usually defined as excess production of thyroid hormone. Firstly, we learn about hypothyroidism. So, what will cause this issue? Suppose if the problem lies with the thyroid gland, then it is known as primary hypothyroidism. If the problem lies with the hypothalamus or pituitary gland of the brain, then it causes central hypothyroidism. How does thyroid hormone gets regulated in the body? Before moving into the causes of primary hypothyroidism and central hypothyroidism, I would like to explain how it gets regulated in the body. Hypothalamus secretes thyroid releasing hormone. This stimulates pituitary gland to secrete thyroid stimulating hormone. Thyroid stimulating hormone passes instructions to the thyroid gland to secrete T3 and T4 depending upon the level of T3 T4 levels in the body. These T3 T4 hormones are composed of iodine. So, firstly, coming to primary hypothyroidism. The causes are iodine deficient areas such as mountainous areas of Central Africa, Latin America, and Southeast Asia where there is less of iodine in the ground. So these people suffer from hypothyroidism. If there is excess of iodine also, it doesn't allow proper iodine uptake into the thyroid gland. That causes primary hypothyroidism. Suppose if the iodine levels are sufficient in the area, then mostly it is due to Hashimoto disease, an autoimmune disorder where the body wrongly recognizes its own cells as foreign cells and destroys them. Some drugs such as amiodarone, which is given in heart problems, lithium for mood disorders, and interferon alpha, interleukin 2, and tyrosine kinase inhibitors in some cancers and inflammatory diseases also interfere with iodine and causes primary hypothyroidism. And surgical procedures such as thyroidectomy, where the thyroid gland is removed in cancer, and in some deliveries also there is transient hypothyroidism where it is automatically normal after few days. It also causes primary hypothyroidism. Thyroid infiltration disorders such as amyloidosis, hemochromatosis, where if there is excess of iron or an abnormal protein in the body such as amyloid, may deposit in the thyroid and causes functioning of thyroid to go low, and this causes primary hypothyroidism. And if suppose there is some infection in the thyroid gland, which is very rare. Central hypothyroidism is caused due to head injury or pituitary gland tumor or drugs such as dopamine, bexarotene, glucocorticoids, somatostatin analogs. What are the symptoms of hypothyroidism? The person who was previously energetic and active now becomes lazy and inactive and does not feel like doing any work. They easily put on weight even on low diet, cannot bear cold weather. There will be excessive hair fall, constipation, cannot concentrate on any work, poor memory, gets tired easily. Menstrual irregularities may be present, gets depressed easily, slow heart rate, dry skin, puffy face, wrist pain, muscle aches. Any age group people can be affected. Both boys and girls can be affected. If there are no symptoms, but there may be TSH raised in your blood, that is known as subclinical hypothyroidism. So, if you have symptoms or not, better to get checked every year for hypothyroidism. If the babies are born with this condition hypothyroidism, it is known as congenital hypothyroidism. Mother thyroid hormone is present in baby's blood for about 48 hours. To know whether the baby is suffering from congenital hypothyroidism or not, collect blood sample in between 48 to 72 hours, and it's compulsory to do the test because if the baby is in hypothyroidism, the brain does not grow well. As we all know, brain grows rapidly in the first 2 years of life and they remain as dwarfs and mentally retarded child. This condition is known as cretinism. Let's learn about the early symptoms of hypothyroidism in babies. Jaundice lasts longer than usual. The baby is very lazy, may suffer from macroglossia, which means large tongue, and can have feeding problems. The soft spots of the head may be large and remain open for a very longer time. Dry skin may be present. Low appetite means the baby doesn't feel hungry and may be born with a condition known as umbilical hernia. To know whether you're suffering from hypothyroidism or not, we usually do blood tests to determine the levels of T3, T4, and TSH. And to know whether you're suffering from autoimmune disorder of thyroid or not, we measure thyroid peroxidase antibodies. If T3, T4 are normal and TSH is raised, then the condition is subclinical hypothyroidism. If T3, T4 are decreased and TSH is raised, then it is overt hypothyroidism. If T3, T4, TSH all three are decreased, then it is central hypothyroidism. Levothyroxine is the treatment of choice for babies, adults, or pregnant women. And levothyroxine should be taken at least 60 minutes before breakfast or 3 hours after evening meal. And pregnant women should not take this tablet with iron and calcium. Once you get hypothyroidism, there is no cure, but you can control this condition by taking thyroxine hormone from outside, measuring your T3, T4, TSH levels every year, and adjusting your dose accordingly. Please consult your healthcare practitioner. I have explained in Goitrogen's video what all foods you have to avoid if you have hypothyroidism. Thank you all for watching.